So what I focus on is I just want you to get up and move as frequently as you can throughout the day. Get in this position, get in this position, stand up, take a walk, get in a hip flexor stretch. Anything you can do to move as frequently as possible throughout the day.
As a chiropractor, what are some of the top things you might be missing with your low back patients? My name is Dr. Jeff Langmaid with the Evidence Based Chiropractor, and I'm fortunate to be here with Grant Elliot of Rehab Fix. He's a certified strength and conditioning specialist, and we're gonna break down some of what he's seen in the strength and conditioning world and how chiropractic fits in, and maybe some areas where, as a practicing doc, you can improve either your assessment or your back end to make sure that you are helping your patients get the best results possible. Grant, thanks for coming on.
Thank you so much. Happy to be here. It's an honor.
For the docs that are unfamiliar, talk a little bit about Rehab Fix and yourself.
So, my name is Grant Elliot, certified strength and conditioning specialist, and I'm a trimester 10 student at Logan University out of St. Louis, although now I'm finishing my rotations here in the lovely city of Tampa. What Rehab Fix is a social media account, primarily on Instagram, that I created around a year ago that I use to both spread educational information, help as many people as I could that I couldn't see in person, as well as build myself as a future provider and help learn more and learn how to teach a little bit better.
What are maybe some of the pitfalls that you've seen in terms of patients that you've seen, people that you've seen in the strength and conditioning world who have seen chiropractors concurrently, and maybe things that those docs didn't see or didn't have access to that you've seen in their world in the gym?
One of the biggest things is that I'm in on the field or in the gym with these kind of people trying to perform their activities that they're trying to get back to. Very often these patients or athletes, whoever it might be, when they're in the chiropractic clinic, there's not really a gym atmosphere or they're not doing their competitive athletic event there. And so sometimes the carryover isn't exactly concise. So what I have the opportunity of doing is working with them one-on-one, getting back to their activity. And I would say one of the most, the initial common miscommunications between the patient and the provider in regards to getting back to their athletic event is, should they continue doing it in the first place? I've had some clients who were seeing a great chiropractor and they came back and they weren't exactly sure if they should continue our sessions because, hey, I have this injury, I have this low back issue, I'm afraid it might make it worse. So I would say one of the first most important things is to address with your patient, should they keep exercising, and encouraging them to either do so or to not do so, whatever you might see best fit for that individual patient.
Right. Do you think that ties more to like maybe a challenge in the functional assessment in the doc's office, maybe history taking as far as knowing what their goals and expectations are?
I think it would go back to setting goals and expectations. So a lot of people I see, sometimes they don't even really care that much about some specific assessment or even necessarily the pain that much. Sometimes they just want to be able to play basketball again or go kayaking or get back in their CrossFit community, things of that nature. So I would say one of the best ways to establish what the activities are and what you should continue to encourage them to do is first get a baseline of what their goals are and most importantly what their activity goals are.
Yep. I mean, we were talking a little bit off camera. Sometimes it can be a communication issue. And I guess my question to you would be, how many times as a strength and conditioning specialist for years, how many times has a doc reached out to you and asked you what's going on with the patient?
Almost never. Almost never, unfortunately.
I mean, how do you think that communication could either be enhanced? What do you think the benefits of that would be?
We all know that exercise can be a great thing for a wide array of issues. And I think a phenomenal approach to patient care is collaborating with both your provider and your coach or your personal trainer, whoever might be helping you exercise in the gym and that sort of thing. I think it would be great for more people to reach out and communicate with me and vice versa in the future so that we can both collaborate on the care. And I can go, okay, what's your assessment? What did you find? What do you recommend this patient do or don't do? And so then I can incorporate that into the gym or athletic setting to make sure we continue to improve them towards their goal or towards their recovery instead of accidentally making anything worse.
What are some things that you've seen in terms of functional disabilities or dysfunctions that people have come into the gym with that chiropractors can or should keep an eye out for with their patients?
Here could be an example. Someone someone has some difficulties squatting. Maybe they have a pain in their knee or pain in their low back, something of that nature. Well, something I might do is do a few mobility, a couple maybe FMS screens. We might have heard those terms before in regards to, okay, do you have the necessary prerequisites to be able to correctly perform a squat? So I might assess their ankle mobility through some just ankle tests. I might assess some hip mobility, put them through some mobility exercises, see if they can accomplish that, or see if they can do it up to standard. Those are probably the most common functional deficits I would see in regards to someone wanting to get back to their squat or back to their heavy squat, whatever it might be. And after we assess those, I might be like, hey, you know what? I'm not telling you to stop squatting, but we might need to address these other areas first to get you back to doing that the best that you can.
Yeah, what's with FMS screening, talk a little bit about what that is and how it plays directly between what the patient might be doing in a chiropractic clinic and what the client may be doing in the strength and conditioning world.
Yeah, so FMS is functional movement screen, and it's a very, very fast and effective screen that any personal trainer can use during their initial consultation with that individual or at any time to just get a really quick blueprint of where their stability is at, where their mobility is at, and where they might have some of those deficits. So with that FMS screen, what we can do is we can get those additional findings, those we'll call those athletic findings, so to speak, and a good communication with myself and the provider. I can relay that information. Hey, I performed the FMS screen with Susie, and I found some additional things that might be related to this issue. And I think if we both worked on this together, then we could attack the problem a little bit quicker, and we can make sure she's doing these things on her own and in the gym when she might not be in the office.
Break down the top 2 things that you've seen in the strength and conditioning world that docs should keep an eye out for in their clinic, and if they do, concurrently can help their patients get better results.
I would say one of the first things would be as simple as what exercises should they keep doing? Because you guys are the ones that are doing the professional assessments, really diving deep. I'm more of the movement guy, looking at exercises and things of that nature. But sometimes, even though someone might be encouraged to continue exercising, they might not know what exercises they should be doing. So maybe there's a runner and they really enjoy running and with their community, and they were told, hey, keep running, but they're not sure how long, or they're not sure if they should be doing other exercises related to that to continue to improve. So I would say one of the most important things would be, one, encouraging them to exercise, but 2, determine exactly what exercises they should continue to be doing so that they can be confident in those and they can continue to stay in the activities that they love. On the flip side of that, I would say it would be just as important to determine what exercises they shouldn't be doing. One good example I have is an individual who really, really enjoyed kayaking. And as we all know, when we're in a kayak, we're kind of hunched over for a long period because you don't really have a choice. You're kind of in that tight, space. Mm-hmm. And he really, really enjoyed kayaking, and typically his ventures would be about 4 hours straight. I don't know about you, but that's a long time to be sitting down. I personally would be getting stiff. This particular individual was found to have a flexion intolerant low back complaint. Well, the provider was great in encouraging him to stay active, keep doing what you love, and that's very, very important. But for that temporary time, these kayak ventures were kind of agitating things and making them a little bit worse. So since I'm in the gym with this individual, we're working on movements, we're working on exercises, we went over, okay, maybe let's just modify your position a little bit. Maybe get a lumbar roll, maybe reduce the duration, and these are things that providers could discuss with them as well. So what should they not be doing? Maybe that person should not be doing a Jefferson curl, which is where you're rounding your back as much as possible while holding weight, things like that. So I think it's very important for them to understand, okay, I should be exercising, but what should I continue doing to help myself? And maybe what should I temporarily avoid until we get out of this acute stage?
Gotcha. And let me ask you a divisive question. Flexion exercises for low back, yes or no, and why?
Typically, if we're gonna kind of fall down the McKenzie route, I would say, typically no, but it depends. As we all know, the famous McGill saying, it depends. Most often, I will see flexion intolerant individuals. I typically do not begin with flexion-based exercises with them. We'll start just building neutral, maybe getting to a little bit of extension initially, but I always, always, always make sure that those individuals can safely return to flexion by the end of our time working together.
Gotcha. And have you seen more correlation with ankle mobility issues or hip mobility issues related to low back pain and dysfunction?
I'd probably say hip. A lot of people, they're sitting a lot of the day, their hips are getting tight, they're not loosening their muscles enough, and it's a good saying I like to think of is, if your hips aren't moving right and you're trying to squat, it's like squatting in tight jeans. You just can't do it. So some people, their ankles are fine, but very, very commonly we see poor hip mobility and poor hip control.
Yep. And when you see somebody with, let's say they have a low back issue and they have hip mobility issues, are you typically looking towards the next body region, potentially towards thoracic mobility or cervical mobility as the compensation patterns, or do you find that these issues are isolated?
Typically, we see them very much so connected. There might be some areas that need more of a focus, more of a primary complaint, but with things like a simple FMS screen, we can get a good global picture of where they might be restricted. Maybe the ankles are only restricted a little bit. Hips primary, but then as we know, with squatting or overhead movements, such as CrossFitters getting a lot of overhead movements, we need to have good thoracic mobility as well. So getting a big picture provides a very good specific approach towards where we need to improve on that individual. So I would address all of those regions, but focusing more on the ones that need to be attacked the most.
Yeah. And I guess with today's lifestyle, do you see so many people into CrossFit? There's so many people spending long amounts of time in their car or at their desk at work. And I think of upper cross syndrome, right? I think of shoulder rotation, thoracic hyperkyphosis. When you see individuals who might have low back but concurrent issues up above, shoulder rounding, thoracic hyperkyphosis, do you find that they're more often correlated with overwork in the gym, or that it's more repetitive nature of lifestyle?
I think repetitive nature of lifestyle. So even though we can get a lot of benefit by, at the end of the day, getting in the gym, getting in a good session, we still have to consider that there might be a time throughout the day where you're sitting in the exact same position for 8-10 hours straight. So something I really like to focus on with clients is to not obsess about their posture. A lot of people are told, oh my gosh, you're in pain because of your posture. And sometimes we're just built like this and we can't help it. And sometimes that can kind of be scary for people. So what I focus on is, hey, I just want you to get up and move as frequently as you can throughout the day. Get in this position, stand up, take a walk, get in a hip flexor stretch. Anything you can do to move as frequently as possible throughout the day, I find really, really helps loosen them up and make them feel better, including when they go to the gym and improve in that exercise session.
Yeah. How about your top 2 low back exercises?
Oh man, my top 2 low back exercise would be, I would say number 1, dead bugs. Okay. I post a lot about dead bugs on my Instagram. I always say dead bugs are the best bugs, get them out of the house, And the reason I like the dead bug exercise is because 1, it teaches how to keep a neutral spine and how to properly abdominally brace, create intra-abdominal pressure, which we know is very important, as well as how to move the arms and the legs, which we're doing with shoulder movements or squats, without moving through the low back and maintaining that compression in the abdominal wall to keep that low back nice and stable and safe. The second one I would say is almost, if you were to just flip around on the ground, would be a classic bird dog, developed by Stu McGill, PhD. And this one's great because not a lot of people exercise their back or exercise their glutes or anything like that throughout the day because they're sitting for long periods and they just might not be able to get up enough. But this is a very simple and effective exercise to strengthen the back, strengthen the glutes, and once again, teach that abdominal bracing and low back bracing style.
Is that something that should be done daily, and especially with the individuals who maybe aren't used to abdominal bracing? Do you recommend that they do it in the provider or in the strength and conditioning coach's office, to get started, and how often should they do it?
Yeah, so I would say start it right away. We can always grade these exercises. Maybe they can't do the full dead bug at first. Maybe we're only moving the arms, or maybe we're only moving the legs. Same thing with the bird dog. Maybe we have a little bit of support at first. So we can start at a lower grade if necessary, but I think getting them exercising and getting them stronger as soon as possible would be the best approach. In regards to the location that they do that, I'd say more the merrier. Yeah. So if they're doing it in the office with the provider or in the gym with me, the more that they learn how to properly move and how to properly control those areas and get stronger, the better. And if they're not used to those exercises, if they notice they're getting pretty sore over the first few days, we can back off of the frequency a little bit and then just get them back to that in the future once they're stronger and more robust.
Great. I love it. Big take-home messages are make sure you're communicating with everybody on the healthcare team of your patients. I'd say keep an eye out for those functional activities that your patients are looking to get back to in their life. It's so key to understand where they're trying to get to and what their goals are. And then the third component is get people moving as quickly and as safely as possible. The quicker and faster you do that, the better the outcome is going to be on the back end. Where are some places that people can find out more about Rehab Fix?
So I'm most commonly found on Instagram at RehabFix, and also we have our website, therehabfix.com, where we offer a low back program and online consultations for those individuals that aren't local to Tampa, but I can still help reach.
There you go. Check out rehabfix.com, and I want to thank Grant for coming by. Thanks, man.
Thanks.
Hey, what's going on? If you loved that video, be sure to subscribe to this channel. The Evidence Based Chiropractor puts out videos all the time at the intersection of marketing and research, showing you how to grow your practice while also growing your knowledge base. So if you liked it, be sure to comment down below or hit subscribe, and I'll see you in the next video.